What if I told you that dosage calculations aren't really testing your math? They're testing whether your patient lives or dies? That may sound dramatic, but that's exactly how the next generation NCLEX wants you to think about every single medication decision. Here's the biggest mistake nursing students make. They see a dosage calculation and immediately start multiplying and dividing numbers. But great nurses don't start with the calculator, they start with clinical judgment before touching any numbers. First, ask yourself, does this medication actually make sense for this particular patient right now? Is this the correct dose? Is this the correct route? Is this the correct time for administration? And when you calculate the answer, always ask, does this result actually make clinical sense for my patient? The math itself is straightforward. Oral medications often use a simple formula involving dose ordered, dose on hand, and quantity. For IV infusions, you commonly calculate volume divided by time to find the milliliters per hour needed. But the next generation NCLEX goes much further than simply solving a straightforward equation on a screen. It asks you to recognize unsafe medication orders and prioritize patient safety above everything else. You must identify signs of medication errors and determine the correct next nursing action immediately. That's why students who only memorize formulas often struggle when real clinical scenarios are presented to them. The students who pass are the ones who recall the right formula and apply sound clinical judgment together. They recognize when a calculated answer simply doesn't make sense, and that skill saves patient lives every day. That's exactly why Read, Remember, and Recall exists, to train your brain to remember when it matters most. Don't just learn how to calculate medication doses. Train your brain to think like a nurse under pressure. Because on NCLEX Day, success isn't about getting the math right, it's about making the right clinical decision.